Unless the cause of death is sudden trauma, like a car accident, dying happens over a long period of time.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer.
Hello. I'm Molly Jacobson, the editor-in-chief over at dogcancer.com, where over 40 veterinarians, veterinary oncologists, cancer researchers, and science writers like me work together to bring you better information today so you have no regrets tomorrow. Today, we're going to discuss a very sensitive and emotional topic, which are the signs that you might see in your dog as they near the end of life. It's important to remember that just because you see one of the signs that we discuss in this video, that doesn't mean your dog is automatically dying. They might just need a little support, some medications, or treatment to get them through a rough patch. There are a lot of things that you can do to help your dog, but I'm not going to discuss those in detail today during this video. Instead, we're going to have links to other podcast episodes and other videos here on YouTube, and we're also going to give you links to articles on dogcancer.com that give you much more detail on all of these different signs and how to help your dog in the moment. Did you know that dying happens over months, not hours? It's true, unless the cause of death is sudden trauma, like a car accident. Dying happens over a long period of time. The body dies in stages. Depending on your dog and their unique illness, the signs may differ, but generally they'll follow the same pattern, a same basic timeline. Some of the signs we're going to talk about might show up sooner rather than later, others might show up later rather than sooner, and some might not show up at all. The first part is about the signs of dying that you are likely to see in the last 3 months before death. The second part of this video is about the signs you might see in the last 3 weeks of dying. The third part is about the signs often seen in the last 3 days of dying. So let's begin with what you might start to see in your dog's last 3 months of life. 1. Weight loss. Losing weight without being on a diet is a definite sign that your dog's body is not processing nutrition correctly. A special diet might help. Your veterinarian will definitely be able to help you determine what the cause of the weight loss is and how to feed your dog differently if that's necessary. So make sure to ask your veterinarian for help with this. 2. Loss of appetite. A significant decrease in appetite might just mean your dog ate something they shouldn't have. It can also mean that they're in pain that needs to be addressed. That can make a dog reluctant to eat. But it can also be a sign that your dog's body is beginning to shut down in preparation for death. Offer your dog food without making a really big deal about it and call your veterinarian, because whatever the cause for the loss of appetite is, they can help you address that and determine whether it's part of a larger pattern. 3. Dehydration. Hydration is critical for health and well-being, so you should be checking your dog for dehydration. Tent the skin at the back of their neck at their scruff and see if it snaps back immediately, which means they're well hydrated, or if it stays tented for a while, which means they're dehydrated. You can help them with access to plenty of fresh water, and definitely call your veterinarian about this because dehydration is critical. They need fluids, and your veterinarian can help you both in the hospital and also with things to do at home for your dog. 4. Diarrhea. Persistent diarrhea is always dehydrating and always means there's a problem of some kind. This is definitely a time to call your veterinarian and see what might be happening. Fast your dog in the meantime. They do not need to eat every day in order to survive. So fast your dog to give their system a rest and call your veterinarian to get their help. 5. Urinary incontinence. Not being able to hold their pee can be a common sign of aging. It could also mean there's a short-term problem that can be addressed, or it can be a sign that the body is starting to shut down. Your veterinarian will definitely be able to help you with urinary incontinence, see what could be the problem and if it's treatable or not. 6. Vomiting. Frequent vomiting is a serious sign of ill health of some kind. It could be something short-term or it might be a sign that you are close to the end. It's dehydrating, which, as we've already talked about, is a real problem. So this is a time to call your veterinarian so they can help you determine what's going on, treat whatever it is, and get your dog rehydrated. You guys, severe vomiting requires immediate veterinary attention. 7, dimmed or dull eyes. This might be a little subtle for you to see, but your dog's eyes might look a little dim. This could be because an eye problem is developing, or it could be a sign that your dog is nearing the end of life. Your veterinarian can definitely help to treat something short-term or help you understand what's going on. 8, looking unkempt and disheveled. Dogs do groom themselves. They shake themselves off and they lick themselves. So if your dog is starting to look kind of dirty or greasy or not as fluffy as they normally are, they might be not practicing personal hygiene. When those habits start to go, it can be the sign that their body is shutting down and they don't have the energy to take care of themselves as much as they once do. So at this point, you want to start helping your dog to groom by giving them maybe more regular, gentle, sweet, and loving baths, maybe sponge baths, and ask your groomer for more tips. Remember, any of these signs that occur individually might just mean that your dog's going through a rough patch. There are articles and podcast episodes about diarrhea, vomiting, and loss of appetite that will really help you to understand exactly what these signs might mean for your dog in your own situation. Check for those in the show notes. For every month that we live, our dogs live 4 to 7 months in terms of their aging process. So why 1 month flies by for us, from a dog aging perspective, that's more like our 4 to 7 months. 1, 2, even 3 weeks before your dog's natural death, you may see the signs we've already discussed continue or show up, and you might also see the following signs. You'll notice that several of these are related to anxiety and pain. So now let's look at the last weeks of life. 9, pain. Your dog might start whining a lot or not want to be touched. All of these and more can be signs of pain, so you definitely want to be on top of this. Unmanaged pain is a huge life quality issue, and your veterinarian can help you with medications, other types of strategies, CBD, and other comfort care. So call your veterinarian to get their help. 10, restlessness. This kind of pacing or changing positions a lot, not being able to get into a comfortable position, can indicate that your dog is in some sort of discomfort, pain, anxiety. Again, call your veterinarian if you see this behavior. 11, behavioral changes. Your dog might be super snappy all of a sudden and aggressive, or they might be super clingy and snuggly. If your dog is behaving differently than normal and they're just not themselves, it's time to call your vet. 12, changes in sleep patterns. Your dog might be sleeping too much or too little. Either way, it's time to call your veterinarian because these are signs of depression, anxiety, and/or pain. 13, breathing problems. Any breathing issue is an emergency, whether it's labored breathing, very soft breathing, harsh breathing, slow breathing, or shallow, rapid breathing. Even if these symptoms are lasting for days or weeks, it still hurts to not be able to breathe well, so call your veterinarian as soon as possible. 14, confusion. Your dog may seem confused or disoriented or to not know where they are. This can be a sign of general aging, but it can also be a sign that organs are starting to shut down, so call your veterinarian. 15, depression. Just like humans, dogs can experience depression, and they can start to self-isolate, try to stay away from you. Try not to take this personally. It's not about you. It's about the way they're feeling. Take your dog's depression seriously and call your veterinarian to get help with short-term or long-term support. 16, wanting to be outside a lot. Dogs instinctively seek a place far away from their own family when they are in the dying process. This comes from their ancient instincts to separate themselves from the herd so as not to attract predators that would be harmful for their family. If your dog starts wanting to be outside all the time, try to find a nice and safe spot for them, probably in a place they've never been in before, in your yard, for example, where they can rest safely and protect you from there. Always call your veterinarian if your dog's behavior starts to worry you. I know it sounds like I'm telling you to call the vet a lot, and I kind of am. That's because getting your veterinarian involved sooner rather than later does a couple of things. It helps you help your dog, and it also helps you determine whether they are just in a rough patch that they can recover from or actually in their dying process. Either way, your veterinarian is the best resource for things like comfort care, medications, strategies, and coaching. Here are some signs you might see if your dog has days, not weeks, not months, to live. If you see any of the following signs, especially more than one, it's really time to call your veterinarian and get their help. Now let's look at the very last days of life where your dog's organs permanently shut down. 17, lethargy. Extreme inaction or not wanting to move much is really common at the very end of life. Respect their wishes and don't pressure them to be active. Stay nearby so that they know that you're there for them. Let them rest with dignity. 18, lack of interest. In the last days of life, your dog will probably start to lose interest in their toys or other favorite things that they normally love, activities that they like to do. This is natural. It's part of the dying process. Let them be. No need to push them. It's time to let them rest. 19, lack of coordination. Dogs in the last stages might lose the ability to properly work their muscles, and their nervous system is having trouble sending out signals. It's normal for them to stumble or not really know where they're going, or not be able to walk well. Help them to walk by simply carrying them, or if they're a big dog, using a towel slung under their belly to help them to walk. And take them outside to pee if you can, because even in the end of life, dogs really do still prefer to relieve themselves outside in nature. 20, twitching. Dogs' muscles and nervous system might twitch or have spasms as the systems shut down. This is normal. Just keep them safe and remove anything sharp from the area. 21, weakness. Signs like dragging their hind legs or clearly having trouble getting up or even lying down. These can be signs that your dog's systems are shutting down. Carrying them might help, as well as putting their food and water bowls really close to them so that they don't have to move too much in order to get to them. 22, an inability to control bowel movements. At the end of life, dogs tend to lose bowel control. This is not just diarrhea. This is loss of all control. This is a sign that the digestive organs are shutting down and the nervous system is also shutting down and letting things go before they fully process. Clean them up well and keep them comfortable and dry as much as possible. Also put down towels or pee-pee pads or both so they're comfortable, and when future accidents occur, it's easier to clean up. 23, stopping eating and drinking. When a dog refuses all food and all water for an extended period of time, like over a day, it's a serious sign that their digestive organs have already or are almost done shutting down, and their brain does not see any need to take in extra nutrition. At this point, it's dignified to let them not eat and not drink. You can offer it, but if they don't take it, don't in any way force them. 24, seizures. Seizures are a sign of severe neurological issues in the brain and elsewhere in the body, and they require immediate veterinary attention. While you're calling your veterinarian, if you can physically be near your dog and restrain them or keep them from flopping around too much, maybe by pressing against them, that can both calm them and let them know that you're there and also keep them safe. You're also going to want to have all the objects, sharp objects and furniture moved out of the way as possible. 25, a puffy or swollen appearance. When organs shut down at the end of life, they tend to release a lot of fluid into the spaces in the body, and that can cause a dog to look puffy or bloated. This is a sign that they are definitely in organ failure. Your dog almost certainly needs pain and comfort support right now, so please call your veterinarian. 26, body odor. A noticeable change in body odor, like your dog really stinks, can indicate a really severe infection or organ failure. If your dog smells really bad, call your veterinarian right away. Remember, each dog is unique and each death is unique. There may be other signs that are specific to your dog's illness or condition, and your veterinarian will be able to tell you what to look for in that case. Again, seeing one or a combination of any of the signs in this video does not mean your dog is automatically dying, but it does mean it's time to call your veterinarian. The hard reality is that dying is a slow and painful and difficult process, and it only gets more painful and more difficult in its last stages. Getting your dog comfort and support is absolutely vital to keep their life quality high right up until the end, and your veterinarian is the best resource for that. That's it for today's show. I hope it's been helpful for you. All of us here at dogcancer.com know exactly what it feels like to lose a dog and to watch them at the end of life. So we hope this is helpful for you. Don't forget to subscribe to our channel so you get more videos as they're released, and definitely check the show notes for all of those links to other articles and podcast episodes that will help you understand each one of these signs much more deeply, including how to help your dog more fully. Okay, I'll see you soon. Take care of yourself until then, and give your dog a cuddle from us.
Thank you for listening to Dog Cancer Answers. If you'd like to connect, please visit our website at dogcancer.com or call our listener line at 808-868-3200. And here's a friendly reminder that you probably already know. This podcast is provided for informational and educational purposes only. It's not meant to take the place of the advice you receive from your dog's veterinarian. Only veterinarians who examine your dog can give you veterinary advice or diagnose your dog's medical condition. Your reliance on the information you hear on this podcast is solely at your own risk. If your dog has a specific health problem, contact your veterinarian. Also, please keep in mind that veterinary information can change rapidly. Therefore, some information may be out of date. Dog Cancer Answers is a presentation of Maui Media in association with Dog Podcast Network.